Now I'm going to tell you, no way in hell I'm going to do what he just said. There's no way in hell I'm putting Croft guidelines in there. Do you read my lips? Did you hear me say hell? There's no way in hell I'm going to do that. Who knows why? No, you already know why. The guys that I train know why. Or the guys that sleep during my webinars, like Cole, he won't know why. Never use Croft guidelines. Never. Why? Why?
Confusing.
What?
Because it's guidelines.
That's not why.
Confusing.
No.
Not the standard.
No, I said no. No, those are guidelines, but I said no, that's not the reason.
Discredit all your other work.
No.
Not based on what revisited healing.
No. Croft guidelines are based on the 3 phases of healing. Who are the guidelines written for? No, they weren't. No, they weren't.
Insurance companies.
They were written for administrators. You're a doctor. You are a doctor. Those guidelines weren't written for you at all. You learned those doctors and you learned those guidelines in chiropractic school. You should be able to do that on your own. You shouldn't need guidelines. What's the care based on? What did I teach you the care is based on?
Biomarkers.
Biomarkers and as they relate to what? The 3 phases of healing with potential complicating factors, right? That's what the damn care is based on, and you should have learned that in chiropractic college. Right? Are you with me? What were Croft guidelines written for? Doctors that didn't learn diagnosis, that didn't learn biomarkers, that didn't learn how the body heals? You're telling me that's what the Croft guidelines were written for? No, they were written for administrators, insurance companies and agencies. Chiropractors are using them as crutches. They're totally being abused and misused by chiropractors. And here's the reason you better not use them. Because now you based it on a third-party administrative factor and not the damn patient's biomarkers and how they heal. You better base it on how the patient heals and not an administrative function. He does that in court, I'm going to rip him up. Now, what's the good news and bad news? 80% of the attorneys won't know what I just told you. You'll get away with it 80% of the time. You know how easy it is for me to come in here and for him to cite administrative guidelines, not biomarkers, not how the body heals, as the authority for care? Are you kidding me? And I'm a doctor? You get my point? What a joke! You guys have been brainwashed by this crap. That's crap. The Croft guidelines is based on the 3 phases of healings for administrators. Well, what do you want to use? The source or the administrator? What was essentially created for insurance agencies. Do you get my point? Who's going to have more authority? You, with your Croft guidelines, are me showing my subjective, hybrid subjective and objective, and 100% objective biomarkers and explaining how the patient heals relative to my therapeutic protocol, which was specific for those biomarkers, and as they responded through the 3 phases of healing. Which one makes sense now? Croft guideline. I mean, what a joke. You get anybody and they're going to just take you biomarkers, Croft guidelines. What does that know? It has to do with the patient. It doesn't have to do with some table that was written for guidelines for high school educated administrators that work for insurance companies.
And would that reduce,
do you get my point?
Would that reduce your credibility as a doctor?
Huge.
Yeah.
Huge. Good news is 80% of the attorneys won't catch it. You'll get away. If I'm the attorney
But even when you say it, it just seems like you're giving the credibility away. And you're saying, I'm not a doctor.
You are.
Yeah.
What
and
it-
I'm giving
you are.
Yeah, and that's.
Well, I just told you.
Yeah.
I just told you. Who do you want to go with? Somebody that cites the Croft guidelines or the criteria that I just said? Subjective, objective findings, 3 phases of healing, response, therapeutic protocol specific to the biomarkers, response to treatment. You're in the jury. Who are you paying attention to now? Me or the guy who cited Croft guidelines?
Doctor.
I had a doctor. By the way, here's why I get hyped up on this. Is I had a client one time, he goes, well, this patient, he was talking about patient care, and he says to me, he got an IME. He got an IME, right? He's doing all the old crap before he joined me. All that crap. Not sensitivity biomarkers, not basing it on 3 phases of care, all the crap. You know what I mean when I say this. Chiropractic crap. Just for the damn bill. You know what I mean. He says, what do I, so he calls me, he goes, well, what do I do? I had an IME, and they cut my bill, and it was whatever visits, 30 visits or whatever. I don't remember what it was. And he goes, I cited Croft guidelines, and the Croft guidelines says I get this many visits, and they cut my bill. He goes, what do I do? That little tirade I just did was 3 times as much. I said, you're kidding me. You're really kidding. And he bought into it. He bought into it as a doctor that patient's care was based on a table of guidelines that was meant for a high school educated insurance person. It had nothing to do with the person's subjective findings, objective findings, hybrid subjective findings, biomarker. Had nothing to do with that. It had to do with the damn table that said he should get 40 freaking visits. How stupid is that? The shit you're buying into in this chiropractic industry. And because so many other of your friends have bought into the shit, you think it's normal. How would you like your mom's cancer care based on a table instead of her blood test and her biomarkers? How would you like it? How stupid does it sound now?